Document the care you were trained to give means writing down what the care you were trained to give rather than just what transpired. Think of the example where you have a patient who comes in and he's got a cough and he has rusty brown sputum and he has fever and chills and maybe even has pain in his chest. You know, the first thing that comes to the medical student's mind is pneumococcal pneumonia. So we would automatically, recommend a CBC, a blood count, and perhaps, a blood culture, maybe a chest x-ray. And the doctor recommends it to the patient. The patient says, well, I ain't doing it. I ain't got the money, and can't you just give me, some medicine and cure me? So the doctor says, well, we'll do that, but you call me in 2 days and come back and see me in 2 days. And if you're not, if you start getting worse, call me sooner. So the doctor writes down, we'll give medicine, perhaps an antibiotic. The patient leaves, the patient goes home, and he ends up in the ICU. He's got, every complication that you can get. This guy has a 2-month stay in the ICU, and when he gets out, the hospital is pursuing him aggressively. And they're trying to collect, and the guy gets mad, and he calls an attorney. The attorney looks at the record, and he says, why didn't the doctor try to prevent this? I mean, if he'd done the right thing, perhaps this would have never transpired. So the patient says, well, I don't know. And, they get the doctor in court now, and the doctor tries to explain to the jury how he tried to get the patient to do it, but the patient refused. And the lawyer says, that's not what you wrote down. So if you could go back to the original encounter, perhaps the doctor could say, I want a chest x-ray, and I want a blood count, and I want a culture, and I want you to take these medications. And if the patient refused, the doctor could simply say, just go out and handle it with my nurse. In the nurse's handwriting, it would appear that the patient's refusal and the plaintiff attorney would have to penetrate 2 layers of credibility to be able to affect his cause. The case would go nowhere. I can't tell you how many cases and how many appearances in court this could save our medical profession.